Heartworm is probably the third most common parasite that we see. They are truly worms that live in the heart and the lungs. So when it was named heartworm, it was a great name. You can see this many worms. It can be astounding how many worms can live in the dog's circulation and still have them walking around. The important thing about this life cycle is that it has to go through a mosquito. So a pregnant dog cannot transmit heartworm to her puppies. She has to have a mosquito bite her, and then bite the puppies, and then they can get heartworm. But it is not directly transmitted from the bitch to the puppies. Symptoms of heartworm are cough, weight loss, exercise intolerance, panting, fainting, edema in the legs. They can go into kidney failure, they can go into liver failure. So it's a very nasty disease. They can migrate into the eye. There's a lot of really nasty symptoms. The diagnosis is primarily done now on an ELISA test, and frequently it's done on a test that also checks for Lyme disease, anaplasmosis, and Ehrlichia. So if you hear about the SNAP-4Dx test, it will check for heartworm and those 3 tick-borne diseases, Lyme, anaplasmosis, and Ehrlichia. You can see on X-ray that there are some changes on the X-ray that can be characteristic of heartworm disease. There is a filter test that we used to use in the old days where you actually look for the baby heartworms. Most veterinary clinics don't do that anymore. And you can see them showing up on ultrasound. I actually had one diagnosed this way at our practice a number of years ago. The dog came in with heart disease, coughing. I listened to the heart. The dog had a murmur. We scheduled the dog for an echocardiogram, which is an ultrasound of the heart. And the ultrasonographer, the cardiologist said, "Oh, this dog has heartworms." She could see the worms in the ultrasound. Treatment consists of using doxycycline and prednisone prior to the arsenic injections, absolutely 100% strict rest for months, and then a series of arsenic injections. Typically one is given on one day, and then you come back 4 weeks later and get 2 24 hours apart. It's expensive. It's a big deal. You need chest x-rays, you need blood work, you need all kinds of things before you do this. Don't let your dog get heartworm. It's super easy to prevent. So please, please, please prevent it. Prevention includes ivermectin. It can be as ivermectin itself. It can be ivermectin in a heartworm product. Moxidectin is the injectable product that's given as ProHeart 12. Every 12 months, you can get an injection for this for your dog. And it will prevent heartworm. You don't have to worry about a pill. You don't have to think about if the dog will take it or not. And Moxidectin ProHeart 12 is safe for pregnant dogs and nursing dogs. The other frequently used products are milbemycin, which is going to be an interceptor and sentinel, and selamectin, which is Revolution. So all of these drugs are very common, very safe. Absolutely, you should be using these on your dogs. There's no excuse for a dog to get heartworm disease at this time with the kind of effective preventives that we have. Prevention, I usually try to avoid giving any of the preventives in the first 3 weeks of the pregnancy, just because I prefer not to give drugs during that first trimester when all the tissues are forming. And read the label on your heartworm products. Make sure it says it's labeled for use in breeding dogs. Now, a breeding dog does not say pregnant dog. A breeding dog is a breeding dog. So if you have an 8-week-old male puppy at your kennel that's going to turn into your next favorite stud dog, he is a breeding dog, folks. He is not a pregnant dog. He is a breeding dog. So please, please, please read the label on your medications. Trifexis and Simparica are not labeled for use in breeding dogs. So do not let your vet send that home with you because they are not tested in those breeding dogs. Heartworm incidence is somewhat regional in the country. It has been found even in Alaska, despite the fact that mosquitoes have to transmit it. But the most prevalent areas are going to be in the southeast part of the country where it's wet and warm most of the year. We have some in Wisconsin. I've seen one case in Wisconsin that was a native dog that had not traveled outside of Wisconsin. She was 8 months old. So it's not very common where we are, but it's much more common in the southern tier of states where it's warm and humid.